I'm Dr. Nathaniel Chin, and you're listening to Dementia Matters, a podcast about Alzheimer's disease. Dementia Matters is a production of the Wisconsin Alzheimer's Disease Research Center. Our goal is to educate listeners on the latest news in Alzheimer's disease research and caregiver strategies. Thanks for joining us. Welcome back to Dementia Matters. Getting a diagnosis of mild cognitive impairment, also known as MCI, can have a significant impact on someone experiencing memory or cognitive problems, giving them a concrete answer and name for what they're experiencing. Still, it can understandably also come with fear, stigma, stress, and anxiety. So, what exactly does an MCI diagnosis mean? What should a person do after receiving the diagnosis from their doctor? And what resources are out there to help? Joining me today is Ms. Jennifer McAlister. Jen is the Outreach and Partnership Manager within the Outreach, Recruitment, and Engagement Core here at the Wisconsin Alzheimer's Disease Research Center, as well as a dementia coaching provider. Over her 30-year career, she's held various leadership roles across the long-term care continuum in the field of dementia care. She has extensive experience working with families impacted by neurocognitive diseases like Alzheimer's disease at all stages of disease progression, with a specialized focus on the needs of individuals living with mild cognitive impairment and atypical dementias. Jen, welcome to Dementia Matters.
Thank you. It's an honor to be here.
I want to start by having you explain to me what you think of my definition of MCI. And so I'm going to start by telling you what I say to patients. Mild cognitive impairment is not normal aging. It's also not the same thing as dementia, and it's also not the same thing as Alzheimer's disease. So here I've just told you three things it's not. What it is a way for us to characterize or describe something you might have been struggling with possibly for years. It is a person who is noticing thinking changes, sometimes memory, sometimes not. These changes representing a decline from their baseline, whatever that baseline may be. This person has reached a point where they feel something is wrong. They've had the courage to talk about it openly with whether family or friends. They've gone into their provider and they've had some thinking tests. Those thinking tests have shown a lower than anticipated score, whatever that might mean, depending on the provider. And when they go over their history, you recognize they're still doing everything they have done historically. Their function is still independent, albeit they might have some compensatory strategies, or they might not be as efficient, but they are still technically independent. And so that is how we would define it. And that is actually based on the National Institute of Aging Alzheimer's Association criteria. That is what I would say to a patient who's asking me, what does that mean? Now, what do you think of that definition?
Yeah, I think it's a comprehensive sort of explanation of what is happening to somebody, but it also comes with a lot of questions and maybe even more confusion. So I really,
Thanks a lot, Jen. I appreciate that. It's too long. You tell me, Jen, how would you simplify that?
yeah, I think it's important to to really have this sort of comprehensive conversation with your healthcare provider, right? And so, when I'm working with somebody who has received this, it's even hard to say, is it a diagnosis or is it just a set of symptoms, or is it the earliest stages of a neurocognitive disease diagnosis? There's just a lot of unknowns there. And so there is a lot of value to asking a lot of questions when your provider is going over what the results of their tests, and maybe there's been some scans and other, looking at other health conditions that might be playing into it. I often find that I remember after I had my son, my doctor said, "You can never call us too much because you're a new parent and you don't, everything is new to you." And I think that's kind of comparable to mild cognitive impairment, right? You really can never ask too many questions to try to understand what is driving these changes. I also think there's a lot of anxiety about what does this mean for my future? And there's a lot of stigma that comes with this because a lot of people don't know what mild cognitive impairment is. And so I've run a number of support groups for folks living with mild cognitive impairment for several years. And over and over again, they will say, people tell me I look fine. And that's a point of contention for people living with mild cognitive impairment because they notice that they're not fine. Their healthcare provider has said, I think there is something going on here outside of normal aging, but I don't know if it's a neurocognitive disease or not. So I think mild cognitive impairment, in short, is just a really confusing space that offers a lot of opportunity to partner with your healthcare provider to understand what that means and to have candid and real conversations about what's going on with you.
And Jen, one of the things I take away from your response is that it can't really be encapsulated by a term. And even if it is a diagnosis, it's not simple. And so, can you set the scene for us of what someone might have already gone through just to reach this diagnosis? What happens in the steps leading to a doctor saying mild cognitive impairment?
I think somebody has to build up the courage to be able to have this conversation with their healthcare provider in the first place. And people they may go for an extended period of time knowing that something is wrong, but not necessarily feel comfortable talking about it. So I would encourage people to talk about it sooner rather than later, even if it feels uncomfortable, because it may not be something like Alzheimer's disease. It could be something different that is treatable. So I think easing people's worries is one of the things that I try to do for people. There may be physical exams, there may be complete health histories that are done, there may be brain scans, there may be cognitive testing, a lot of things that feel long and overwhelming. And so people may come out of that exhausted and anxious, and then they have to wait. They have to wait to get the results of all of those things combined. So it's a long journey to go through. So I think there's all sorts of emotions that are just kind of all over the place as people try to figure out what's going on.
And that's just to determine what's going on, right? What's actually happening to me. And I think you did a nice job in summarizing. Eventually, someone has to recognize something's wrong, whether it's the person or the family or friend or the clinician, and then an evaluation starts. But that just leads to this evaluation. In your time working with people living with mild cognitive impairment, what's their initial reaction to the diagnosis? What do they tell you? Are they relieved? Are they shocked? Are they upset? What do you hear?
Yeah, I think it really, a lot of this can be dependent on somebody's coping strategies, how people cope with, difficult news or different trials that they've gone through in their life. It's a good way to understand how somebody might tackle this, space of confusion, if you will. Some people will be highly anxious. Some people will go through a period of denial, which is a normal coping mechanism for all of us. So I don't get particularly worried when somebody is not ready to talk about what's happening to them. When I first meet with people, when I'm doing coaching or consultation work, I'll ask, "What brought you here today?" And some people, actually, a number of people will say, "My spouse." So there may be, other people in their lives that are finding some urgency to talking through some of these changes before somebody might be ready. And so I try to I try to help people put words to what they're experiencing. So, I want people to kind of articulate for me like you did, right? So what does mild cognitive impairment mean to you? How does that impact you day to day? Just to help people put some words to their lived experience, I find can be really helpful. And then I think it's important to ask them what their worries are, what their fears are. And for some people, it's about, do I need to tell people that this is happening? For people who are still working, do I need to tell my employer? It really opens up a whole nother set of confusing questions. I also find that people will not want, if I can say, incidents to happen where some of these changes might be more evident. So you might find people controlling their environment a little bit more. And, the concern for me there is that people will become more socially isolated really early, which can really have devastating impacts on somebody's quality of life. So I think for me, it's about starting with the emotional response and helping them put words to that, not just to digest it on paper, but also inside of them. Like, what is it like now? How do I live in this new skin that I have and continue to live my best life in a way where I'm able to enjoy meaningful activities, and I'm really sensitive to people who are working, that they're able to work even if you need to modify some of the ways that you do things, that people are given opportunity to learn new strategies, to adapt and live well.
So, Jen, we've been talking about the diagnosis and how people might be responding to a diagnosis. But let's talk about what happens before that. What questions should people be asking their doctors leading up to the diagnosis or even, as they're being evaluated? How can they be prepared for future doctor visits even after a diagnosis?
So Nate, these are really good questions, and I wanna just focus on a couple, probably three different areas related to this question. It's my experience that I found that there is a lot to unpack after going through this diagnostic process of understanding what might be driving somebody's changes in memory, thinking, and behavior. And that's true even for people who are living with mild cognitive impairment. So when I'm working with someone, I encourage them to take time to really process what that might mean and how they feel about receiving that information. So, one of the big things that I do first when I'm supporting somebody is really validating and normalizing what they might be feeling. So, if you think about, like, before you are going in for any testing, you know, what if I get the questions wrong? Or, what if the questions are too hard for me to answer? Or just all of this kind of preempting or finding anxiety where you don't even know where it will exist yet. And just so, in that respect, it's really helpful to go through the process of, these are some of the tests or the procedures that they might be doing, just so that people know what to expect. After somebody is diagnosed, there could be a whole roller coaster of emotions that people could be feeling. So they could be dealing with anger, they could have relief, they might be in denial. There's no way that this is what's causing these changes. Depression, resentment, certainly fear. People might feel isolated and alone in this journey. And there is this sense of loss. There's this grieving process that people have to go through when there's changes in memory and thinking. And that is just part of any stage of memory change. You're losing something. And so being able to acknowledge and validate that that's all normal and something that would be expected for what they're living with. So with those things being said, It's important to help people understand that there's ways that we can help people cope with that emotional roller coaster. And and all of these emotions are cyclical, right? So it'll depend on what other things you have going on in your life, and just a whole host of different reasons why you might end up angry one day versus feeling alone and isolated another. And so, one of the questions that would be really helpful to ask after being diagnosed is, can you help me find resources to deal with that? Are there counseling services or coaching services? Occupational therapy can be helpful to help people learn new strategies for how to deal with day to day activities that they've not had to really put any sort of mental muscle into doing prior to having any changes in memory and thinking. But now those things are being impacted. And even health psychology can be used to help deal with fine strategies to overcome some of the different emotional roller coasters that people will more than likely experience at some point in this lived experience. So when we go on to this next section of what are other questions, maybe more tangible diagnostic related questions to ask your health provider, here's just a few to consider. What tests or tools were used to determine my diagnosis, and what were these tools measuring? How will this progress, and what can I expect in the future? And a really important one to try to take some of that fear of the unknown or fear of the future maybe out of the equation or help prepare for what one might experience is, do you think my memory and thinking changes are due to a neurocognitive disorder such as Alzheimer's? Like, it's okay to ask those questions and talk about that with your provider. What treatment options might I be able to consider? And how would those treatments affect the symptoms that I'm feeling today? As a person who is diagnosed with symptoms, are you going to be my provider, or am I going to be able to see my current primary health care or whoever my healthcare team is? Do I get to keep them? What will you be as part of my healthcare team? And then another thing that many people don't know about is that there are some care planning resources that is part of somebody's healthcare benefit. And so I would ask, are there some care planning services that I could take advantage of that my insurance would cover for me? And then outside of the health system, are there any other support services or resources that would be helpful for me to consider using so that I can continue to live my best life?
Jen, that's a great list of questions to be thinking about and asking, especially after receiving such a diagnosis like this and such important information. I think for me, on the other side of this process of diagnosis giving, a lot of times I feel the family in particular wants to know the prognosis. And so they may not ask that question, but I know either at that visit or at subsequent visits, someone will usually ask, at what point is my loved one going to progress to dementia, or how long will a person live with this condition? And I think that's a really reasonable question to ask. Of course, it's a understandable question. Unfortunately, we're not very good at determining that, which is what I usually say to people. And I can give averages when I meet with them, but everyone's course is going to be different. And I did want to share that one of the questions that a palliative care doctor taught me that I have been asking my patients after giving a diagnosis of mild cognitive impairment or dementia for that matter is, what does this mean to you? And for me, that's a way of assessing the impact of the information. And I think that's a powerful piece of information because it helps me not only understand how much they've understood, but what's important to them and what they're going to do with this information. Um, and so I think it goes both ways. There are important questions that need to be asked in this conversation. Um, but moving forward, Jen, you've shared questions about what patients can ask their doctors when receiving a diagnosis, but how can they be prepared for future doctor visits following the diagnosis? What kind of questions should they be asking at subsequent visits, or how can they be best prepared?
As we're thinking about future questions, there's a lot here to consider. And so I would just offer just a few things to think about. And one would be to document any changes in your health. And that would include changes to your mood, to your memory, and changes to your behavior. And one behavior that I see in helping a number of people with mild cognitive impairment is that anxiety shows up really early. And so that is something that your healthcare provider can help you manage. And there are a lot of non-pharmacological ways that we can deal with anxiety. So please bring that up to your healthcare provider if that's something you're living with. Bring a list of your current prescribed and over-the-counter medications, and that would include vitamins and supplements. And consider bringing somebody to future appointments, a trusted family member or friend. And then make a list of questions that you would like to talk about with your provider. It's like Murphy's Law that we'll think of a lot of really good questions, and then we get to that clinic visit and we can't remember any of them. So, having those prepared, giving a copy to your provider and keeping a copy for yourself will help you keep track of, did we talk about this yet, or is this something that I should mention again? And then I just want to close out this list of things to consider with, it's really important to get this information in writing. This is a lot to digest, and asking for written summaries so that you can go back and review the information later can be very, very helpful when somebody is dealing with memory and thinking changes.
And so, let's say a person's just received their diagnosis, and I know that you've met with people who have been in that situation. What's the first thing you recommend they consider doing?
Honestly, the first thing that I do with people is make sure that they're emotionally okay. Sometimes I call it a sucker punch to the gut. Sometimes I'll say, does it feel like the wind has left your sails, or like the air is gone from the room? It's just this period of time where you just kind of have to sit with it. And you don't necessarily have to figure anything out, but you have to kind of be in the same space with it. And so working through that first, in my experience, has helped people get to the next thing. Okay, what is valuable to you today? What are you worried about, or what are the things that you would like to focus on today? So it really is making this a tailored, person centered approach. And some people might focus on their sleep. Some people might want to focus on organizing things in their home. It could be anything. Some people might want to focus on, how do I improve communication with my loved ones? It's hard for them to understand what my pressure points are, and how do I communicate that without people feeling bad, and or people discounting what it is, because it is really hard to see mild cognitive impairment. So for everybody, it's different. I wouldn't say there's this canned approach to what is the next thing, but there are specific things that I like to get people to. And so education really is one of the primary things I want people to grab onto. I want people to have a foundation that they can work from, a deeper understanding of what this means, and how do I live with it? And how do I keep on doing the things that I enjoy doing? There is a This is a period of time where we have lots of opportunity. If somebody's cognitive changes are due to a disease process like Alzheimer's, we have a period of time where they are able to steer their ship for as long as possible. And that gives us really valuable information when we think about what somebody's future needs might be, and how we would want to go about meeting them. So helping people identify, who do you want on your support team? Do you have all of your legal and financial documents taken care of? Do you understand what this long-term care system is about and how you navigate it? Do you know how to identify when something is off? Not just because we all have periods of forgetfulness, but when something is unusually off. And do you have safe people that you can go to and talk to so you can get support and they can help you work through that? So it's an opportunity rich space. As confusing as it is, it's also filled with so much more. And people will oftentimes share with me, I'm focusing on the things that are really valuable to me now. Like, time means so much more to me today than it did before I knew that this was happening to me. I've even helped people plan vacations, which is something I never thought I would ever be doing as a service for folks living with cognitive changes. But people like to travel and they like to live their life, and so how do we help people do that and empower people and help them feel confident and capable? And it's easy to focus on our losses. I think my job as a provider is to help people see their strengths.
You said something in your answer that I was going to ask a question about, and that is sort of legal, financial health planning. Where in this space should people really start checking to see if they have these documents, they've had these conversations? When should people have done this? And if they haven't done it, when do you recommend they do complete this?
That's such a great question, Nate. And I will say we should all do it after we turn 18 because we are considered our own people at that point. And so we should have our legal documentation, our documents all set up. It should just be part of our overall health and wellness, is to make sure our legal and financial um, houses are in order. And so I would say before you have any issues with changes in your cognition, but a lot of us don't do that, and that's okay. That's not the end of, but I do think the sooner the better, with the caveat that I really think dealing with the emotional impact of what is going on is primary to other things, because without working through that, it's difficult to do the other things. We'll put things off because it's hard to address it. And so deal with your emotional health, digest what this is for you, take some classes, and then look at your legal and financial documentation. And it wouldn't be a bad idea to connect with an elder law attorney. It takes a lot of anxieties off of the plate when you know what you have to work with. And anxiety is something that people living with mild cognitive impairment experience early on. And I don't know if you see that in clinic or not, but I certainly experience it when working with folks. They're worried about a lot of things. And so working through those worries, it takes the load off, and it actually builds capacity to be able to let the strengths in our cognition work for us rather than have those anxieties working against us.
Jen, one of the worries that I see in a lot of people is whether or not they're going to share this diagnosis or this news with other people, whether it's their family or friends. And what do you say to these individuals who are considering this? Is there something they need to prepare in advance, or how do you help people wrap their heads around this future conversation?
So I have used a tool called a decision making tool that is, people learn how to use it in a class that I have facilitated in the past called Living Well with Chronic Conditions. And this is an evidence-based tool that folks use when they need to make difficult decisions. And who should I tell? That's a difficult decision. And so this decision-making tool is really easy to use. You would list, you just can use it on a sheet of paper, but you identify what your question is. And the question is, should I tell people? Or you could even identify ahead of time, who do you think you would want to tell? So, should I tell my spouse? right? That's a very targeted action item, a specific person, versus should I tell my supervisor at work? You're going to have different pros and cons based on who that person is that you're thinking about. So, should I tell my spouse? And then you on one side of your paper, you list all the reasons that that would be beneficial. And on the other side of the paper, you list all of the reasons why that would be not so beneficial. And then you go through and you give a ranking or a weight to each of those reasons. So on a scale of 1 to 5, with 1 being least value and 5 being most, whatever your reasons are in each of those columns, how valuable is that reason to you? You do that for each thing that you list. And then you go through and you add it all up and you see what does this tell me on paper? What does this tell me? And then the last thing that you want to do is what's called the gut check. And so does this, all this work that you did to get this on paper, does it match what your gut is telling you? And it's just a really good way to get that big problem out of your head so you can see it. And I have had folks tell me that that has been one of the most helpful tools that they have received from taking that particular class, because there's so many questions, and it's a person-centered way to approach the question, and it helps you identify if now's the right time or if not. So say your values don't match what your gut is telling you. Maybe that's a signal that maybe it's just not the right time to tell somebody. And then you can go back later and do that decision-making tool again. And you might get some different answers, or the things that you've written down in each column might have a different value rating than the other time that you did it. So it's a really great tool. I've had folks use that tool for a number of things, but the one that was incredibly impactful for me was a gentleman who was deciding when to stop driving. He knew that this was an issue, and so we worked through this decision-making tool together, and it was phenomenal to just be part of that conversation with him and understand what was really driving this hard decision he was trying to make. And I actually learned a lot from it that I now use for other people, because it was so impactful to me to hear it right from him, that these were the things that are bothering me and they were not what I thought people think about. So it was really an enriching experience for me as well.
So, Jen, you run a program through the Wisconsin Alzheimer's Disease Research Center called Healthy Living with Mild Cognitive Impairment. And this is a quarterly webinar series where individuals can get support and learn about science backed strategies for living and coping with the MCI diagnosis. How did this program start? What inspired you to get involved with it? And just provide us some key highlights about it.
Yeah, I'm really excited to share with listeners information about healthy living with MCI. Like you said, it's a quarterly education series in that it began in 2019 as a way to help people living with mild cognitive impairment learn about science-backed information to help them continue living their best lives. And the program began as an in-person event offered to Madison area residents. And during the pandemic, the series pivoted to virtual programming. And just like other education programs that were going on at the time, we found that through virtual programming, we were able to reach more people who were experiencing symptoms of changes with their memory and thinking. And since the pandemic, we've continued to have researchers, clinicians, and other guest speakers provide the education virtually. But in 2023, we added something different and we piloted offering in-person sites. And we partnered with 3 different dementia care specialists that were working within the Aging and Disability Resource Centers in Wisconsin. And these pilot programs were well received, and we have expanded the number of in person satellite locations that are available throughout the state. So I'm really excited about that and what it offers to people for getting really good educational information, but also being able to get local support and being able to connect with other people who might be living with these same changes right there in their own communities. So people can find a comprehensive listing of this year's viewing sites on our Healthy Living with MCI webpage, which is adrc.wisc.edu/MCI. The educational content for Healthy Living with MCI is guided by the Lancet Commission report on brain health risk factors. And this report is important because it shares information related to dementia prevention, intervention, and care. And the most recent report highlights 14 modifiable risk factors that could reduce or prevent cases of dementia by as much as 45%. So that's really our guidepost. That's what we use when we're pulling this education series together. We've offered a number of different education topics related to diet, exercise, sleep, cardiovascular health, legal and financial planning, emotional well-being, social connectedness. And our latest one, which was last December, was all about hearing loss and how that can impact our memory and thinking. And there's so much that we can learn about that will help folks who are living with mild cognitive impairment. We've also opened the series up to anyone interested in learning about brain health, including professionals who are currently supporting or may be supporting people living with MCI in the roles that they hold. Many of our past programs have been recorded and are accessible on that same program webpage. So we encourage people to go and take a look around that webpage and click on everything that is of interest to them. We have another great lineup of speakers this year, and we are working to have all of those events confirmed soon. So keep an eye out on that webpage for that information. But we do have our first program, which will be held in March, already secured. And this will be on the topic of integrative medicine and partnering with your healthcare team. And we're excited to welcome Dr. David Rakel, who is a family medicine practitioner and a leader in the field of integrative medicine. And Dr. Rakel has helped develop a whole health model of care at the VA, and his presentation will focus on lifestyle interventions and ways to partner with your doctor that focus on areas of health and well-being that matter most to the patient. So I'm really excited about that. He is also going to share a personal health survey tool that will help people to improve communication with their healthcare team. So that program will take place on Friday, March 14th. And again, for more information on how to register, you can go to our Healthy Living with MCI webpage.
Are there other programs or resources, either like Healthy Living with MCI or maybe different, that you'd recommend to those newly diagnosed with MCI or even mild stage dementia?
Yeah, that's a really good question, Nate. I like to answer a question like that with a yes and. So there may be other education models similar to Healthy Living with MCI. I don't know for sure. But when we look at what is it that people need for a comprehensive support, I like to help people understand that education meets one need, but there's going to be other support pieces that will be beneficial to somebody to help them live their best life. And so support groups with other folks living with mild cognitive impairment can be hugely beneficial. Counseling services can be hugely beneficial. Coaching services where we really take that education and apply it to your individual circumstances and create action plans and we work together to figure out how to navigate that can be incredibly beneficial. Occupational therapy, speech therapy, physical therapy, accessing all of those services that we might not think about as being helpful for mild cognitive impairment actually can improve quality of life exponentially. And then what sorts of technology is available that helps people navigate through these changes that they're having that allow them to remain independent? So there's a lot of resources to consider.
Jen, wouldn't it be nice if there was a piece of paper or a reference that people could have that would list those types of resources after receiving a diagnosis? How come that doesn't exist?
Well, it does exist, but we just have not really found a way to get it out to the masses yet. So a few years ago, I was on a crisis intervention task force in Waukesha County, actually, and I was on the task force that was meant to help caregivers. And my philosophy was that I think we're not we're not looking upstream far enough, that we really have to address these needs in as early as possible. And based on all of the experience and work I had been doing with people with mild cognitive impairment, one of the things that we ended up developing out of that work group was what I call a flow chart. It's not really a fancy name or anything, but it it's really been built off of the things that I have done over the years to help people after they've been diagnosed. And so it's kind of like a roadmap to the resources that you need. And so we have a flow chart that we have available on our website for people to access so that they can learn more about what questions should I be asking my doctor, and what does my diagnosis really mean, and so to click on different links and get that education about their condition. What are the treatment options that are available? What are some things to think about as I'm working through, like digesting what this disease or these conditions mean for me and my personal story? And what are some education programs to consider, or some online resources that would be helpful? Or what are things I should think about when I'm planning for my future? And how do I stay socially connected and build community with other people living with these cognitive changes? And then, are there safety concerns I should be thinking about? Are there clinical trials or research opportunities that I could be a part of? Um, and are there other places I can go to receive help and support? So this flow chart actually has all of those resources in one document, and all you have to do is click the link. And folks that I have shared this with have found it to be very, very helpful.
And we'll have that link in our show notes, or you can find it on our website. And with that, I'd like to thank you, Jen, for being on Dementia Matters and sharing your experience and wisdom with us. And really in fighting the good fight and helping people who have learned that they've just been diagnosed with mild cognitive impairment and live their best life with that diagnosis.
Well, thanks again for having me, Nate. It's been a pleasure.
Thank you for listening to Dementia Matters. Follow us on Apple Podcasts, Spotify, or wherever you listen, or tell your smart speaker to play the Dementia Matters podcast. Please rate us on your favorite podcast app. It helps other people find our show and lets us know how we're doing. If you enjoy our show and want to support our work, consider making a gift to the Dementia Matters Fund through the UW Initiative to End Alzheimer's. All donations go toward outreach and production. Donate at the link in the description. Dementia Matters is brought to you by the Wisconsin Alzheimer's Disease Research Center at the University of Wisconsin-Madison. It receives funding from private, university, state, and national sources, including a grant from the National Institutes on Aging for Alzheimer's Disease Research. This episode of Dementia Matters was produced by Amy Lambright Murphy and Kaylin Rauerdink and edited by Alexia Spevacek. Our musical jingle is Cases to Rest by Blue Dot Sessions. To learn more about the Wisconsin Alzheimer's Disease Research Center, check out our website at adrc.wisc.edu. That's adrc.wisc.edu. And follow us on Facebook and Twitter. If you have any questions or comments, email us at dementiamatters@medicine.wisc.edu. Thanks for listening.